All right. Hello, everyone. Excuse me. Welcome to Rehoboth Health Links. Welcome, 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 welcome. Please go ahead and share the video. Call your neighbors, call your friends, because it's going to be a great time of information, that is going to be given out. A great time of information that is going to be given out. So, excuse me. So please call your neighbors, call your friends, let them come and join us in this session of information. All right. So once again, this is Rehoboth Health Links. We are a healthcare organization that is based in Nigeria and also the United States of America, based in Florida. So in the US, we do health coaching, health management, and health talk. Health coaching, health management, generally. But in Nigeria, we do health coaching, health talk. We also consult. We see patients in Nigeria. So, so if you're joining us from Nigeria, if you want to have a consultation with us, you can follow us on the link. Follow us, and you can message us on the information that is going on under the screen. So you can follow, or you can message us, and make sure you follow us on Facebook, Instagram, and you can send us message on WhatsApp. All right. So please go ahead and share the video. So my name is Dr. Tandy Oyemi. People call me Dr. O. Because they just find it easier to say Dr. O. All right. So I am a family practice practitioner, and also with a specialization in obstetrics and gynecology. So I had my MD degree in Nigeria, my obstetrics and gynecology higher diploma in obstetrics and gynecology in Dublin, Rotunda Hospital, University of Dublin, or also known as Trinity College, University of Dublin, in Republic of Ireland. So majorly, I'm more into health education, but also do practice consulting. So, but we are opening up organizations. We're opening up various aspects of healthcare in Nigeria, which we're going to be sending out information very soon. So, but what we do, it is all about managing your care. We give quality health care, particularly women's health, because that's my area. Women's health, OBGYN, that's my area. So please go ahead and share the video, So we're going to be giving a whole lot of information today, because today we are talking about infertility. We are talking about infertility. And it's one of the areas that I'm so much interested in. Because I really want couples to be happy, because that's very important for them. And the infertility is one of the things that do affect couples. So please share the video. Let everybody know that we are having a discussion on infertility. And disclaimer, this is not to treat your conditions. Information that you're getting here is not to treat your condition. It's just for information, just health information, general information. So if you want us to see you privately or personally, there is consultation number that is running. So you can send us a message. So we will get in touch with you. We do telemedicine also, majorly telemedicine also. So, but very soon we're going to have a on-ground physical location in Nigeria. Because if you're based in Abuja, Lagos, if you want to see us, you can always see us. Okay. So our goal is to give you quality health care. Okay. So if you're in Nigeria or anywhere in the world, if you want a great health care, we can manage your care, by providing every available resources, either to help you to come to the United States so that you can get that quality care that you really want. Okay? So very, very important. So please make sure you share the video. We'll try our best. All right. So we're talking about infertility. Now, infertility is one of the things that, like for instance, in the United States here, about 15% of couples do experience infertility. So it's something that is in a way common. And when couples are together, married, let's say couples are together, after some time, interest do develop that, okay, let's have a child. let's have a child. So, and a whole lot of factors can actually delay the couples being fertile. Okay, so let's first of all, what is infertility? When we talk about infertility, now infertility, it is inability of couples to achieve a pregnancy. Couples, remember I say couples right now because it takes a man and a woman. Now, it is a broad topic and it's a broad thing, but that's why we're calling this particular one part one. Okay, so we're going to have part two probably this coming week, but we'll let you know. Just make sure you like our page on Facebook at Real Birth Health Links, on Instagram Real Birth _ Health Links. Okay, just make sure you like it so that you can always get notification, and make sure you hit the notification button. Okay, so inability of a couple to achieve a pregnancy in 12 months that they have been living together, staying together, living together, and having unprotected sexual intercourse. Now, I like to add this to it: mutually consented, unprotected sexual intercourse. Now, some might say, well, why you say mutually consented? Because at times, one of the couples might be on contraceptions, which means they might be taking one pill or the other, or whatever it is, that's whatever method that they have chosen. I mean, they have that they have not disclosed to their couple. I mean, to their partner. So as a result, both might be trying to achieve, but one might not be actually be sincere. That's not the area that I really want to go into. All right, but what I'm just saying is that couples are having unprotected sexual intercourse. Okay, they've been trying that for at least 12 months, mutually consented. All right, at least 3 times unprotected sexual intercourse per week. Okay, in 12 months. If the age of woman is less than 35, notice the age of woman, if it's less than 35. But if it's greater than 35, 6 months. So which means couple has been trying to have a baby for up to a year. If the age of woman is less than 35, if the age of woman is greater than 35, we say 6 months. Why? Because greater than 35 years of age, the percentage of the woman being able to, the percentage of being able to reproduce goes down. So that is why we put that factor of age into it, so that if it's less than 35, 6 months should be okay. All right. So after 6 months, we're just thinking what could be the possible factors, what could be the possible contribution. Possible thing that is causing the couples not to have a child. Okay. So now, one thing that I must also say is that being able to have a baby, it requires time and timing. Let me explain. The time. What do I mean by the time? Now, a woman do have cycles, which will range from 21 days to 35 days. Cycles every 21 days or every 35 days. Okay, in between 21 to 35 days. Okay, so they do have their cycles. Now, in having their cycles, there are different phases of the cycle. All right, different phases of the cycle. So, for instance, there is a time in that cycle that egg has to be produced by the ovary. So if the timing is not timed very well, nothing can happen. Okay, because once egg is released between 12 to 24 hours, it should be fertilized. Okay, a man, his own sperm can still range to like 48 hours, sometimes maybe 72 hours. So there is a specific time in the cycle that egg is being produced. We call this ovulation. Okay, ovulation. So if the timing is not right, or if the couples don't time the timing, then nothing can happen, because it takes the sperm and the egg to come together to achieve a baby. So if that is not happening, then nothing can happen. Okay, so the egg we have to know the timing of the egg. And as we're going to go on, we're going to discuss some of the things that the woman can experience in our body that we say, oh man, I think I'm ovulating. All right. And that's the time that's okay. We need to do the thing so that there's going to be a maximum chance that the sperm can fertilize the egg. So a woman has a cycle. So in that cycle, there are different phases of that cycle. One of the major things that happens in that cycle is the ovulation, which means the egg being released by the ovary. Because the sperm and the egg coming together forms a baby. So the timing of the ovulation is very important for both couples to know that. And there's a whole lot of signs that the woman can experience that can tell them, oh, I think I'm ovulating, because that's what we want the sperm to fertilize to result to a baby. Okay, to result to a baby. So once again, within 12 months of trying to have a baby, the woman's age is less than 35. Then, if it happens, okay, good. I mean, the woman's age is less than 35. Then we know that's still okay, like 12 months. But if the woman's age is more than 35, if it's more than 35, then we need to start investigation early. We don't wait till 12 months. We don't wait till 12 months. Okay, we don't wait till 12 months. So it requires time and timing, or let's put it this way, effort and timing. Effort and timing. All right. So sometimes maybe the time that the ovulation happens, it might be the time that the man is tired or the woman is tired. Okay. That's an effort on each part. And the effort also in the aspect of the woman to be timing the ovulation. Okay. There is a basic way where we can ask the woman, be taking your temperature, from the particularly after you finish your menstruation. Okay, be measuring your temperature, use a thermometer. So she has to be recording this. So once she sees a spike in the temperature, okay, we're gonna say, okay, we got to get the job done. You have to get the job done. So less than 35 for 1 year. They have been trying to have a baby for 1 year. The woman's age, less than 35. They have been having mutually consented, unprotected sexual intercourse at least 3 times in a week. Okay, great. But if the woman's age is greater than 35, then we have to start thinking about what we're going to do. Okay, because the chances goes down as the woman's age goes up. All right, for many reasons. All right, so we need to understand that. Now, the other thing that I'm going to stress is it takes man and a woman to have a baby. So it's not just the issue is not just the woman. All right. I know in some cultures believe that, okay, the problem is just the woman. It's just the woman. No, it's not. It's not. As a matter of fact, couples factor that actually leads to infertility, 40% of it comes from the man. You can see that 40% of it in couples right now. We've investigated according to studies. They've since done so many things. It was discovered that 40% of what has actually caused the infertility comes from the man. So it takes the sperm and the egg to make a baby. All right, it takes the sperm and the egg to make a baby, and there are a whole lot of factors that can lead to this. All right, so there is a male factor, there is female factor, male factor, female factor. Okay, male factor, female factor. Now, because the process of making a baby is much more, or let's put it this way, the reproductive system in a female is much more complicated than a man. All right, because of various things. Because the woman, it is the one that is going to receive the sperm. After the sperm is received, the sperm has to travel. Okay, then has to fertilize the egg. Then before the egg is being released, there are a whole lot of things that has to go in the woman. Hormones being released from the brain, then get into the ovary, help the process of the cycle until it leads to ovulation. Then eventually the sperm comes up. Okay, so a whole lot of things takes place in a woman than the man. The man produces the sperm. Okay, that is why the female reproductive system receives the sperm, while the male reproductive system introduces the sperm. So once the sperm is introduced into the woman, many process takes place. So the woman, the sperm travels up, fertilizes the egg, then the egg begin its development. The egg has to move from the ovary through the fallopian tubes, get implanted into the uterus. Being in the uterus, guess what? It's got to be implanted, and being implanted, then the body of the woman is carrying the baby until its term. 9 months. Okay, so there are a whole lot of processes that goes on in women. So that is why in factors that can lead to infertility, the factors is much more higher in women because of all different stages that involves in a woman. So once again, this is the disclaimer. And again, the disclaimer: we are not diagnosing your problem, your infertility problem, through this broadcast. but we are giving you education so that you can know what is going on, how reproduction happens, how babies are formed, what involves in making a baby. Then if you have further questions, you can consult us or you can go see your doctor. Okay, so very important that this is not to diagnose your medical conditions, all right, or your infertility conditions. So we need to understand that that male and female are involved in making babies, all right. So today we're going to concentrate on the male. I'm just going to speak for like a couple of minutes so that if anybody has a question, you can always type the question. Okay, as I said, it's a broad, okay? Because this is one of the areas that I'm personally interested in fertility, being able to help couples so that they can have the joy of having their own babies. Because one of the things that could do cause tension in marriage is child, it's child, all right? It's child. Maybe they've been together for 1 year or 2 years and nothing is happening, okay? So it could create tension, all right? So in our organization, we are particularly interested in infertility. Once again, my area of specialization is obstetrics and gynecology, but I'm personally interested in fertility because we really want to put joy into couples. All right, so let's look at the aspect of man. Okay? The aspect of man, all right? So we need to understand that there are a whole lot of things that involves in a man, all right? So I'm going to show you a couple of things here, which, remember, this is a medical information session. So we're going to see a couple of things, okay? So it is a medical information session. So, I mean, we just have to see this, okay? All right. So take a look at this. This is the this is male reproductive system. All right. So in male reproductive system, there are a whole lot of things that are involved. Which makes eventually being able to introduce the sperm. The male reproductive system, particularly the penis, what it does is it helps is an introducer. The penis introducer. But where the sperm and usually produce, it is this testis here. The testis here. All right. So the testis has a channel. This channel that we call vas deferens, so which helps to transport the sperm. Okay, as it's transporting the sperm, there are several additions that some other organs or some other glands are going to produce, add to the sperm. So for instance, the seminal vesicle, which is right here, okay, then we got the prostate right here. They all make contribution. And eventually we're going to have the semen being let out, okay, during ejaculation, okay, after orgasms, okay. So you can see that this is the structure. Now, we are seeing this structure, something can go wrong with this structure. All right, we're going to come back to that. All right. Now, before the structure, there are a whole lot of things that are taking place. For instance, when a male child is being born, there is a particular chromosome that is called Y chromosome, which is going to enable this person to be a male. Okay, the Y chromosome produces the testosterone, which is the major male hormone that helps in the development of the reproductive system. Okay, so things can go wrong in all of this structure, or things can go wrong even in producing the male reproductive system. All right, so there are structural defects that can lead to infertility. There are also hormonal defects, structural defects, hormonal defects, and also environmental defects. Okay, diet, smoking, alcohol, all of those things can lead to infertility. All right. Now, as a matter of fact, the most common factor that leads to infertility in a man, it is low sperm counts. Okay. Now, why? Because the testis, it is the production center. The testis, it is the production center. The testis right here, it is the production center. So if the production center that is supposed to be producing is not producing, then nothing can happen. So it might be as a result of infection, toxins, so many things that can affect the testis. Okay. Now, in producing the sperm, the whole thing starts from the brain. It starts from the brain. Okay, the whole thing starts from the brain. So it starts from the brain. Let's see, let's get a good layout. Okay, starts from the brain. So because the brain, it is actually where the major directions is being given out, the brain. So that is why when we are trying to find out what could be the cause of infertility in a man, we don't just say, okay, let's let's just do this. Okay, there are a whole lot of factors that we consider. Okay, like we take the blood to check for the hormone levels. Why? Because in the brain, so let's say this is the brain. This is the brain. There is a place in the brain that is called hypothalamus. Hypothalamus. Okay? This hypothalamus, it is the control center that controls a whole lot of things in our body. And one of the things that it controls in our body, one of the main glands in the brain, which eventually leads to the releasing of hormones that is going to help the testes. It is pituitary, a pituitary gland. So there is a pituitary gland right here. All right. So there are two sections of this pituitary gland. There is the front section and the back section. Okay. The front section and the back section. The front section produces hormones that we call gonadotropins. Gonadotropins. Okay. I'm not going to go too technical, but a whole lot of us are probably familiar with this. The gonadotropins could be the FSH, the follicle stimulating hormone, and the LH hormones. Okay. Now, before the pituitary, this is the pituitary. Before the pituitary can actually produce these gonadotropins, the hypothalamus has to send a signal to the pituitary. All right. So with this signal is in form of the hormones that is called gonadotropin releasing hormone. Okay. It's called gonadotropin releasing hormone. We just call it GnRH, gonadotropin releasing hormone. All right. Now we're focusing on a man right now. Focusing on a man. All right. We said there could be hormonal defects, structural defects, so many things happening, which might make the man not to be fertile. Okay, not to be fertile. Okay. Before a man and a woman can have a baby, I mean, before a baby can be formed, it has to do with the man and the woman, the man and the woman. So it's not just the woman alone. All right. So the gonadotropin releasing hormone, this hormone is going to talk to the pituitary right here to say, okay, begin to produce these hormones. All right. The FSH, which is the follicle stimulating hormone, LH, luteinizing hormone. So what is it that they're going to do? The FSH and LH. The FSH and LH, they're going to talk to the testes in the pelvic area, in the lower part of the body. All right. So they're going to talk to testes. All right. Remember, the testes is the manufacturing center for the sperm to be produced. Okay. So they're going to talk to the testes. So each of these is going to ask a specific function that is going to do in the testes. So the FSH, which is what we call follicle stimulating hormone, is going to talk to the testes to help the testes to produce sperm. Okay, to produce sperm. To produce sperm. All right, I'm repeating that. All right, because sperm are cells which they begin with very primitive until they get developed into matured sperm. So that is why when we're going to do infertility workup or medical or checkup in a man, we say the man the man should abstain from sex 2 to 3 days, then bring a sample of the sperm in a clean bottle. Within 12 hours, we analyze the sperm. We call it seminal fluid analysis or sperm cell analysis. Okay, so there are a whole lot of things that we're going to check on the sperm. The sperms, can they move very well? Are they able to move very well? Do we have adequate sperms per meal? Okay, per meal we expect a man to have at least 20 million sperm cells. So what are the structure of those sperms? There are some, maybe they don't have the head, and the head is important. So let me do this. So the head is important. All right. So the head is important. So this is the tail. All right, this is the head. And in this head, there is a cap that is necessary to be able to drill into, oh, okay. I think I just lost my something there. To be able to drill into the ovary. Okay, being able to drill the wall of the ovary so that eventually the sperm can travel, can get into the oocyte, which is the egg, into the egg. Okay, into the egg. So that the sperm should be able to drill and get into the egg. Drill the wall of the egg. This is the egg. Okay, this is the wall. So there is something on the top like this. Okay, that should be able to. So when we look at the sperm, make sure that we have a whole lot that has all of those things. It's got a long tail because it uses the tail to be able to swim. Okay, the head is okay. It's got those things so that it can be able to drill this wall, so that eventually it will be able to make its way into the egg. Okay, this is the egg. So you can see that. All right. So the FSH and LH helps. The FSH helps in producing the sperm. LH helps in producing testosterone, because testosterone is also important in sperm production. Okay. Apart from helping in sperm production, it helps in producing libido, which means sex drive. Okay, because sometimes if the sex drive is not there, nothing can happen. Okay, it takes a drive, the urge to say, okay, I want to have sex, to be able to have sex. If the urge is not there, and testosterone helps, in producing that. Okay, helps in producing that. So some women, some men, they tend to exercise a whole lot. They work out a whole lot. They go to the gym almost every day. There's nothing wrong in that, but if it's excessive, it can affect fertility. Why? Because the testosterone, it is made from the fats. So which means they are going to the gym, they are exercising, they are burning all of this fat, and nothing to make the testosterone, nothing to make this testosterone, which is basically made from fat. So it can happen in a man, it can also happen in a woman. A woman that is of athletes, maybe she's training, she's a dancer that dances every day. She works out every day, either in dancing or whatever it is. Or maybe they have a eating disorder. They are not eating regularly. So if the body doesn't have adequate fats to be able to make this, then the male and female hormones is going to go down, because the male and female hormones, what helps the body to make it is from the fats. It's from the fats. So if a man is burning out a whole lot of fats all the time, nothing can happen. Okay, nothing can happen. He's not going to be able to make the male hormones. Same thing with the female hormones. So no sex drive. All right, no sex drive. In fact, as a matter of fact, we've actually tell some patients, you know what, we reduce the amount of exercise, your gym time, reduce it. All right, so increase your fat level up, so that we can get things, so that the body can get things to make the hormones, so they can get things to make the hormones. So very, very important. All right, so the FSH and LH, they are important in producing sperm cells and in producing hormones. In producing the male hormones. So you can see that everything starts from the brain, Everything starts from the brain. Sometimes when a man is so overly stressed, it can shut off this production of those hormones. It can shut it off. So also is in women. We're just focusing on the man right now, okay? So that is why if we're going to do a workup for a man, we're going to take the blood, check the FSH, the LH, the gonadotropin releasing hormone, check the testosterone level. Why? Because all of those things are important in a man, So the hormones are produced from the brain. They go into the testes and they begin to tell the testes what to do. So now in the testes, there could be a whole lot of other problems also. Maybe there is infection in the testes, anything infection, toxins, or whatever it is, environmental factors, smoking, excessive alcohol, all of this can affect the body, okay? Maybe there is a medical disease, genetic conditions can affect the body or the testes, all right? The testes, it is the manufacturing center. So if infection, cancer, whatever it is, maybe somebody is on the treatment for cancer, the effect of the radiation can affect testis production. So testis is not going to be able to produce. Also, some of us male, we like to have underpants that is so tight. Or some of us, we like to use our laptop. We put our laptop on our lap, and you know there is so much heat that has been generated. Okay, you see, there is a reason why the nature puts testes on the outside. All right, it is to make sure that the testis is not in the same body temperature. It is to make sure that the testis is not in the same body temperature. Why? Because if the testis is in the same body temperature, those sperm cells can be killed. Can be killed. Somebody put a laptop, on his lap. The heat is just imminent, is just coming out. Just directed to the testis, or maybe the underpants, the underwear is just too tight, and it makes the testis to be so close to the body. Okay, no. The temperature of the testis should be lower than the body temperature. The nature did it that way. All right, it's not just for putting it outside sake. No, there is a reason. There is a reason, because if the temperature is too high, it can kill those sperm cells, and that can lead to reduced sperm cell counts. And even what the sperm cells looks like, it can affect them also. Okay, so too tight underwear to the body can affect the sperm production. It can affect it. Or putting your laptop on your lap and the heat is just getting it can affect it. Okay, so the testis is a delicate organ in a man's body. Okay, delicate organ in a man's body. Remember that I told you that one of the main leading factors for a man infertility is low sperm counts. Low sperm counts. All right. Why is it that the sperm has to be much higher? Has to be much high, because once the sperm is introduced into the woman, once the sperm is introduced into the woman, the chances that a whole lot of them going to die is so high. It's so high. When we get into the female reproduction, I'm going to show you, because there is a tiny hole in the female reproduction where millions of sperms, they are trying to make their way in. Okay, in the process of making their way in, there is so much of accident between themselves, and then eventually some of them dies in the process. So few makes it up. Few makes it up. Because what do I mean mix it up? There is a section in the female, the fallopian tubes, where fertilization usually takes place. So if they are not able to get in there, then nothing is going to happen. All right. So we have to have adequate number of the sperm cells, so that in the process, if many going to die, so we're still going to have a whole lot that is going to make it up, so that eventually one is going to fertilize the egg. Okay, so structural defects, hormonal factors can affect male reproduction. So the problem is not just for the female, it is male and female problem. It is male and female problem. Okay, so for instance, a man that is over 40 years, that is just like we have a menopause in a man, there is something similar. I mean, in a woman, menopause in a woman, there's something similar in a man that we call andropause. Okay, so as man's age is advancing, the testosterone level production decreases. As a matter of fact, greater than 40 years, it's almost like the testosterone level decreased by about 11%. Okay, and testosterone is important for sperm production also, and also for sex drive. So it reduces. All right. So male factors is also important as female factors. Very, very important as female factors. All right. As I said, our diets, too much exercise, tobacco use. There are some medications that some patients are on that they have this side effect of reducing sperm cells. Okay. So as I said, it's not just enough to produce sperm. The sperm has to be of great quality, all right? Has to be able to move. So that is why in a sperm cell analysis, we look at the structure. Can they move very well? Are they be able to, do they have a long tail to be able to swim? Stuff like that, okay? Very, very important, all right? So, the amount of the sperm, the amount of the volume of the sperm, very, very important, very, very important. So these are some of the things regarding male. These are some of the things regarding me. I think I've spoken like 40 or about over 30 something minutes right now. So I want to take some time to answer some questions. As I said, we are focusing on male. Okay. For a man, you got to understand that the problem is not just female problem alone. There is a male problem. Your brain has to work very well to release hormones, okay? Or your hypothalamus releasing the hormones to work with your pituitary, and your pituitary releasing the hormones so that they can go work on your testes. Your testes is the production center, all right? So if the production center is bad, then nothing is going to be produced. It can be as a result of tobacco use, alcohol, toxins, infections, so many things. Or bad diets, okay, can affect the sperm production. Even sometimes, another thing, let me show you another thing. Even sometimes in bringing in the sperm coming out, there is a passage through which it's going to come out. There's a passage, all right? This passage, let's see, all right? So this passage, that is called vas deferens, this passage, which is where the sperm is going to travel through. It's going to travel through. So if there is a structural defect in this passage, okay, in this passage that is coming out, nothing is going to come out. Nothing is going to come out. Or even if this excess accessory glands, seminal vesicle, prostate, they are not producing adequate thing to help the sperm. The sperm might not have the ability to be able to swim, okay? Because one of the things that the seminal vesicle produces is it supplies the fructose through which the sperm cells gets the energy to be able to move. So you can see that a whole lot going on. Even when all of these are in place, even if the penis has problem, okay, non-able to erect, non-erection, or what we call erectile dysfunction, then the sperm cells cannot produce. The sperm cells cannot be let out. Or even the sex drive. If the sex drive is not there, nothing can happen. So you can see that there are a whole lot of different things that are taking place in a man in order for reproduction to take place. All right? In order for reproduction to take place. So the issue is not just with a woman. There is also man's part too. There is also men's part too. Okay? So that is why we have to take a whole lot of things into consideration. So once again, this is not to diagnose your problem, but if you want a consultation with our organization, Rehoboth Health Links, send us a message, okay, so that we can see how we can help you. We are so much interested in this area because we really want to put joy into family. One of the stress in families, it is inability to have a child, okay? One of the stress, inability to have a child. All right, so let's see if we have questions. If you want to send us a question, you can send it to us. You can send it to us either on the messenger, or if you just want to send it on the messenger there, on the comment section, you can. You can also send it there if you have general questions, or if you want one-on-one consultation with our company, okay, we will be much more happy to help you. And remember, okay, it is not free, but it is not a back-breaking price, okay? So because our goal is to, first of all, is to put joy into families, all right? So I'm checking, let's see if we have any question. So if there are any questions. So as I said, we're going to try and be coming online once in a week this way, okay? Now, we're going to discuss a whole lot of various health issues, stuff like that. Like last time we discussed about weight management, hypertension, diabetes, which we're still going to visit. But I just want us to talk more about this infertility because it is one of the problems that has been happening to couples, okay? So let's see, do we have any question? Let me check the messenger. Let me check the messenger. So if you want to put your questions right here, you can. But if you don't want, as I said, you can message us. All right. Somebody already messaged us, said, how can I book an appointment? So you can book an appointment by sending us a message on our messenger, Rehoboth Health Links, on Facebook. Then on Instagram, Rehoboth_Health Links. Okay, you can send us message because so that we can book an appointment with you, so that we can listen to your case. All right. So we do telemedicine right now. Telemedicine. Very soon we're going to have on-ground location in Abuja and Nigeria. So we do telemedicine right now. And the good thing is, with technology, with COVID, telemedicine has actually gained a whole lot of ground. All right, let's see. All right, so it seems that everybody is cool. There are no questions. So please share the video. Let's people know about this, because information is very important. It's very important. As I say, a whole lot of us men, we just go around, we put on the much more tight underwear, and we are wondering how come I'm not able to have a baby. Probably, maybe that might be the factor. I'm not saying there is. We need to see what is going on. Okay, probably that might be it. Might not. Okay, and maybe some of us are just eating some bad diets too. Okay, or some are just smoking and just drinking somehow, or some are just heavily exercising, going to the gym every day. Okay, probably that might be. All right, but if you want a personal consultation, the information is right there. So this coming week, I'm going to try for us to come back online so that we look at the female factor. Okay, so there is no way that we can exhaust all of the information. Okay, we're still going to be revising this oftentimes. Then sometimes we can focus on the treatments. Okay, some of the different ways through which are available to help. Okay, and the good thing about it is, 85% of couples, over 85% of couples that are going through one treatment or the other, eventually do achieve pregnancy. Okay, so when a woman and a man have been living together for 1 year and the woman's age is less than 35, they're having mutually unprotected sexual intercourse of at least 3 times in a week, in a year. No baby, then they need to consult. Okay, see your doctor, or you can also see us. All right. Then secondly, if the woman's age is over 35, then we say 6 months. So they've been living together, they've been trying to have a baby, having mutually unprotected sexual intercourse, okay, at least 3 times in a week, less than 6 months. If the woman's age is over 35, we say, okay, there's something going on. Infertility might be going on. They might need some help, okay? And again, 85% of couples that are seeking for one thing or the other, they're getting help from doctors, do eventually achieve pregnancy, okay? So, as I said again, being able to have a baby, it takes time and timing. So when we get into the female section, we're going to look at the different phases of a woman's cycle, all right? Why is it that couple has to understand those those phases? Because it's not just having sex. The sex has to be timed in order to achieve results, particularly in the couples that are trying to have a baby, okay? All right? So if there are no questions, thank you so much for joining us in the Real Birth Health Links. Okay, once again, we are a healthcare organization where we provide quality healthcare. All right, we do health coaching, health talk. So if you want us to come and maybe in your organization, church, mosque, if you want us to come and give health talk, all right, we can come. All right, we can do that through Zoom. Or if we are in your area, you want us to be on ground, we're welcome to do a whole lot of demonstrations. Okay, so in Nigeria, we're going to be in Nigeria in October. So if you're watching us in Nigeria, if you want us to come to your church, to your mosque, to your organization, or whatever area that you want us to help you with concerning your body, to understand your body, your health, we will do that. Okay, and again, it's not free, but it's not back-breaking price. Okay, but if you want us to just have this, you want to have like an online webinar, something, you want us to give the talk, health talk on any disease, on any health issues, we will. But we specialize on women's health, okay? But hypertension, blood pressure, so many things, medications, so many things. You just want to understand, what is my doctor saying to me? I don't even understand all of this time, all right? A whole lot of us doctors, we're busy, okay? Part of what we do in Real Birth Health Links is we help you understand what is going on, your conditions. We help you understand what the doctor has told you so that you can personally make your informed decision. Because the time might not be there for the doctor to explain what is going on, but telling us what it is, we break it down in a simple way for you so that you can understand, so that is going to help you to make your own decision. We don't make decisions for you. Your health is in your hand, okay? But having adequate understanding is going to help you to make your own decision. All right, so thank you so much. So see you next time.